Listen, I really want to tell you this truth about metformin. Your doctors did not get enough time to tell you, but it is very important that you know. Before we go right into this video, kindly like it already and subscribe to this channel. Many guidelines recommend metformin as the first-line treatment for type 2 diabetes, and this is simply because it has always worked. There are several studies supporting its efficacy in A1C reduction, cardiovascular benefits, and moderate weight loss. It is also said to be effective in treating conditions like PCOS, gestational diabetes, and even newer studies shows its benefit in cancer prevention. Now, let me start by telling you how this medication works. I'm very sure people with type 2 diabetes or insulin resistance can relate with the fact that there is usually lack of energy, especially in the period before you get diagnosed or before you begin active treatment. Sugar, which is the final breakdown of carbohydrate food, is the primary source of energy. In diabetes, there's a lot of sugar, but the problem is that it's stuck and trapped in the blood. It's not reaching the body cells. The body, however, thinks that the lack of sugar is related to poor availability, and because of this, the liver, which is a storehouse of sugar, begins to pump them into the blood for the body to use. Now, metformin steps into the scene and says, liver, hang on a minute. The problem here is not supply. The real problem is that this blood is trapped within the blood. It's not being mobilized into the body cells. So I need you to reduce that production. Now, metformin leaves the liver and walks up to the muscle and the fat cell and says, hey guys, the whole place is sticky. There's a lot of sugar here. I need you to begin to absorb more sugar into your cells so that the whole concentration of the sugar can reduce. Metformin leaves this place and then goes straight to the intestine and says, intestine, you can't afford to move more sugar into the blood. The body has enough sugar, but the problem is that it's not absorbed. So please do not compound the problem here. Metformin also tells this intestine to pull back the excess sugar it has already released into the blood and pull it back into itself. Bear in mind, metformin does all of these things simultaneously. Very effective, right? But I have some things I really need to tell you. It's not to scare you about this medication. In fact, as a diabetes nurse, I recommend the use of metformin a lot for my type 2 diabetic patients. However, there are certain things that your doctors don't often get the time to discuss with you. The first thing I really want to tell you about this medication is that it can take a while before you start to notice changes in your blood sugar. Be patient with it and just let it do its trick on your body. It can take about 48 hours to few days before you begin to see its maximum effect on your blood glucose readings. The second thing I want to tell you is that you may experience some side effects in the first couple of weeks of treatment, couple of days of treatment to weeks. And this is simply because of its activity on your intestine. And this is why it's advised that you build up your dose gradually or you use the modified release version instead. I've made a video talking about the best way to take metformin. Do well to watch it using the link after you're done with this video. The third thing I badly want to tell you about metformin is that you should not take it when you are feeling severely ill. Most especially when this illness is accompanied with nausea, vomiting, diarrhea, severe infection or sepsis, or you develop acute kidney injury during the course of this illness. You should stop taking metformin temporarily and seek medical guidance on when to restart. Before we talk about the fourth point, please subscribe to this channel just in case you forgot to do, because I can tell you're enjoying this content already. Now, the fourth thing about metformin is that the health of your kidneys really matter in the use of metformin. Metformin can induce what we call lactic acidosis. From the term acidosis, you can already tell that it's going to be harmful to your body. This is, however, a very rare side effect as it only happens in less than 10 in 10,000 people taking this medication. One primary cause of metformin-induced lactic acidosis is reduced renal clearance. Reduced renal clearance simply means reduced ability of your kidney to filter off waste and medications like metformin. And reduced renal clearance will tend to happen if you are also severely ill, like I explained previously. It's very important that you constantly check the health of your kidneys through a test we call eGFR and creatinine or urine albumin creatinine ratio. The value of this eGFR is also used to categorize kidney disease. Studies and guidelines suggest that those with kidney functions of more than 45 can cope with the maximum daily dose of metformin, which is 2 grams in divided doses, while people with a kidney function less than 30 should generally abstain from taking metformin. Also, people with eGFR between 30 and 45 can tolerate only the maximum daily dose of 1 gram. So it is very important, very important that you follow your healthcare provider and let them make this decision, as they will be looking into your overall health. Now, the fifth thing I want to tell you about this medication is that there is risk of vitamin B12 deficiency. And vitamin B12 deficiency is a simple side effect metformin causes. B12 deficiency often presents as feeling of pins and needles to the extremities, and some people often mistake these signs for diabetic neuropathy. So it's important that you check your B12 at least once every year if everything is fine. The sixth thing I want to tell you about metformin is that you might be endangering yourself if you are a chronic alcoholic on metformin. Binge drinking can cause irreversible kidney damage, also known as acute kidney injury, which can reduce the renal clearance of metformin in that period of time, causing lactic acidosis. In addition, alcohol intake also causes the buildup of lactic acid through a slightly different pathway that can worsen metformin-induced lactic acidosis. And finally, metformin does not replace your lifestyle modification. Don't start metformin thinking, oh, I'm now on pills for my diabetes, no need to stress myself about regular exercise or eating healthy. Medications are only meant to be an adjunct to your lifestyle modifications in the treatment of type 2 diabetes. In fact, eating high sugary or high fatty food when taking metformin can increase your likelihood of stomach upset. And there you go, 7 crucial things to note when taking metformin. Please go ahead to like this video and subscribe to my YouTube channel, and also share this video with your diabetic friends and family or whoever you think will benefit from it.